polio people, beaucoup pass the blind, pass other categories the way they look around. Because you find out, see, the awareness normally, the country normally to develop and the negligence of some parents, them and everything. So you find out, see, when you look at the type of, for the different categories of disability, polio are more out there in the streets. You understand, within our wheelchairs, with the whole culture, with everything. Find out, see, that the modern streets, they big. And mostly, the moment where some parents, they don't get their hearts, forget that say, all is not lost. Last still hold on to this, me picking a manner. So it's they don't know when they give up. Who meet in the express, so they see who go they want to go up. We see parents they also go left picking before the gate. You understand? So now pass the mothers them, the aunties, and they can take them. You understand? For go take care of them. So beaucoup now so, and if you not be lucky for let you get support, trust me, you man yourself, you go yourself, you not go school, you not get formal education, you not get any formal or informal education. Trust me, at the end of the day, you get for eat, you get for wear clothes, you get for do things, you end up in a streets big. You understand? So now so we see most of your colleagues then because the parental care not there, because you not get support from somebody where they can help you, you not get a home, you not get that guidance so you can say, well, let's see what you are able for do. So at the end, you did in a street. So we seriously may not can really blame my colleagues and some of the older street. Although to some extent, you're able to make decision on your own.
Okay, now you fortunate for like get help, just like we say, and as a person with a survivor, and you self you had an organization, and you just say most of the thing in the week happen to picking the week make they end up get polio now because of negligence and safe parents them not be aware of some certain thing in those days. But now most of the awareness in known day and save the vaccine. So now an organization, what you know they do in the light day, especially for parents within the province system.
Yeah, because I can one key thing we see now as a union, it's about for disability issue. Anything we look about disability issue about health. Not the way you talk about disability issue, where you know the big health issues because it varies from there, all gone. So it's about one. We don't before even being the president, some of who don't be a advocate, who don't be a lobbyist to government or other stakeholders them and due to be a service provider for say the act for let we get a persons with disability act. And in this act, you don't tell you for say section 70, they tell you forget free medical services as persons with disabilities. It's about thereby pushing it for make we able for enjoy those facilities. Well basically the Ministry of Health and Sanitation more gets this work because then gets the department, various departments who then get to look at under 5 children and also those things, and you get now the free health care where they tell you say pregnant woman is free under 5 children. So you get all those opportunities for you able for take your picking for free market where you know they pay nothing except you want for do to nurse or doctors or whatever. So it's about we the as a survivor for tell the story, for tell people and say yes it's real. You understand? See, you not take you picking and you not take you picking for market. It's obvious you will end up like a day. And I don't think say I go want for make you picking end up like a day because I know what I go through. So basically it's about doing a very rigorous sensitization on the issues of poliomyelitis, also engaging the parents. You understand? The parents also how we can able for see get them counseling essential. For see because if you don't you picking on day at that peak now, which you for do now for cancel the parents, cancel the picking itself. See how you can able for get a rehabilitation process for them. Thereby when you say rehabilitation process, try for know this speaking in parent try for no side they which they do, how you go able for help and for make you reform them from this stage where they for letting yourself able for tin up. So those are the things that we as a union we engage and do to certain authorities them. And the most important thing we as a union the main role where we set up is now for the advocacy. So we continuously do advocacy to the Minister of Health and Sanitation, see how they're able for engage the relevant authorities like the Minister of Social Welfare and other people and for see how they go able for make sure say this thing not die out, the continuous market they happen, and how we go also go use the media like how they do so, like who can get other programs them for tell them the realities of life, how all is not lost and good before you then say prevention is better than care. Do the prevention before the care. So those are the things that we really do as at now anyway.
Okay, the program is still a listen to now your own challenge where they can to live from the Society for Edu Democracy 98.1 FM. You can also listen to on the internet on www.edudemocracy.sl. Well, I still get with me Santigi Bangura, we na the Sierra Leone, we na the president for the Sierra Leone Union on Disability issue. Well, idea for talk about the polio, we like the WHO don't declare African country them free from outside or don't make a certification day, because this na issue where according to Santigi Kagbo think say na thing we don't affect plenty people them, and we themselves glad for the certification. The program is still a listen to our own challenge, where they can rely from the Society for Edu Democracy 98.1 FM, where we go take another issue inside the program. Tuesday, August 25, the World Health Organization will celebrate the WHO Africa Region Polio-Free Certification Day, where this certification celebration, according to the WHO team lead for the expanded program on immunization at Salon, Dr. Thompson Ibu, he say this na way for sure say polio not in Africa again. For more on this, make we join Musa Kamara.
The World Health Organization African Region Polio-Free Certification Celebration August 25 this year. Now for declare Africa free of polio sickness, we mean say the sick not in Africa again. This day, according to the World Health Organization WHO, na big one for the African region for free from the sick, but within a polio. Now the question we have been put to Dr. Thompson Igbo, team lead expanded program on immunization at the World Health Organization na Salon.
The cardinal signs and symptoms of polio basically are the fact that the child or the person will experience weakness or paralysis of the hands or the legs. Mostly the hands will need the upper hand, the one hand, the right, or the left, or both. Also be one or both of the legs, or a combination of legs. And the person will not be able to utilize these legs or hands to do anything meaningful. So that means the person will be incapacitated, and that will be a problem for him, a burden for himself, for his family, for the society.
According to WHO, since 2007, Salon no record any new polio sick we make inside 2010. Then been declared Salon polio-free country. But according to Dr. Igbo, the impact of polio still in a Salon since then.
Polio is a disease that causes paralysis that remains. The paralysis is permanent. When it happens to the child or the person, the legs will not recover. So a lot of those persons we are seeing on the streets today are old cases of polio. Okay, so any of them that had polio in the past, you still see them having the signs on them because the paralysis is permanent.
So we're saying they are survivors.
Thank you very much. That's the right word. They are polio survivors.
But waiting Salon need for do now for continue the fight against polio, make it not come again. Dr. Igbo again.
The basic things we need to do is to keep our environment clean. Hygiene is very important because, like we know, the dirty environment is what brings about a lot of diseases, called germs that goes into that. So that's one. Then the other thing is to continue to vaccinate our children, all our children there, to be vaccinated against polio disease using the polio vaccine. So in other words, all children should take polio vaccine appropriate for their age. The vaccine is in two forms now. We have the one we give by mouth and the one we also give by injection. They all depend on the age of the child, those injections. So we encourage all mothers and caregivers to ensure that they vaccinate their children against polio and also take other vaccines. There are so many other vaccines that the country is providing. They should take them and to keep their children healthy and safe.
Rotary, a humanitarian organization, we get about 38,000 club them all over the world with more than 1 million member them. We don't they support the world pan different thing them. We one pan area them. Na the fight against polio na the world. We then don't they support the world pan since 1979 to date. But whose kind role they don't they play inside the fight? Batloi Warite, na the chairman for the committee where they take care of polio issue them na the Rotary Club Freetown.
In 1988, we joined UNICEF, WHO, Center for Disease Control, and WICEF for let we push, for let we get a way in which we completely pull polio in the world. And they call the eradication of polio globally. Almost nearly 30 years, we don't able affect more than 2.3 billion picking them where they don't get that drop where they can put in their mouth, where they call polio drops. Now they make sure say any picking under 5 years old no go get polio. But we don't work primarily in this group where they together so now before raise money where we the hand over to WHO, World Health Organization, and UNICEF for let they're able to do the work on the ground through the national partners.
But waiting next from Rotary Club for CC, then continue their support for campaign against polio na the world battle again.
As of the 25th, WHO did declare Africa free of polio. We own part of the work we do now for continue for raise funds. Okay, like for this year, we own club, therefore try get $1,500 where we join hand with all the other clubs in the world. For now we raise $100 million and we put another fund towards the polio eradication program. In 2013 and 2017, we joined hand with a group called the Bill and Melinda Gates Fund. It's a some of it. I don't know you listeners then go hear about Bill Gates, one of the richest men in the world. Here in WEF, then create this foundation. And from literally about 2002, they begin join hand with Rotary for see how they can give you money for this program here. So the money what they gather now, like this 100 million we will raise this year, we will give UNICEF, we will give WHO, and then they carry out the field day-to-day work with the government partners then wherever they do. So wherever UNICEF they then get polio program in collaboration with the government.
Even though WHO they declare Africa today from polio sick, Batilwai Warite end up for call on people and government of Salone for continue for do thing them where they make sure say the sick not come again na the country and the continent at large. For the Society for Radio Democracy, Musa Kamara.
The program is still a listen to on our own challenge where they can to live from the Society for Radio Democracy 98.1 FM. You dey say also listen to on the internet on www.radiodemocracy.sl and say if you watch we live now Radio Democracy Facebook page. I still get with me Santigi Kagbo, when are the president for the Sierra Leone Union on disability issue. Well, it don't talk here, but the while polio day where WHO don't give certificate to African region them for SECA, where African region and don't be polio free. After we for long term them don't affect by this particular sick for picking them, especially when they're under 5 years. Now with this good news way like WHO bring to Africa region safe na Salone, wetin una think of this?
It's good, but also like I say, they lastly say there is more room for let we do more work. I think say waiting WHO for really do now for say how they will able for look at the survivors and how the victims and we would have victims and now because we now the people are waiting for able for showcase for tell for able for move the parents them for say yes this thing is real because like when you know say when something done if they begin tell you if the one who know nobody war they will pick it and begin to explain about the war right now. Trust me, you not even get tendency for them to believe say they can't atrocities they do them they say they cut down they cut food and this and bone nose everything for let they even believe. You understand? If you not get tangible evidence for show them. So for we would they really think say the WHO for really hold we now are the victims we are the survivors we did now for say yes how we go able for engage the society how for able for engage the parents for let them get the real belief say yes if you not take your picking for go take the poliomyelitis vaccine now so you go end up like how this person did. You understand? And to be realistic enough, I will tell you, say, that much collaboration, no day we would see. You understand? We not see that much collaboration we would expect for make. Obviously, we're able to get from the relevant authorities. We get the disease control people, and we at the Minister of Education of Health. You know, would they expect to see how would the Sudan they engage with self, waiting for happen, waiting for do. For example, when they can get this polio free day, when they can get this market, when they can go around at the hostel. It's also good for say, yes, when I get the nurses there, when I get them people that where they go. But how can you take one or two victims, then let them go along, let them see some realities of life. You understand? Say this not the thing way if you not take this vaccine, now so you picking will end up. And obviously, no matter how successful some of it go be, how we go feel say we don't in a society, but nobody no go still want for them picking be a disabled person.
Okay, now, what will they say the WHO African region be able for get success over this wild polio in African country them where this they should say, then it might as well be helpful for other biggest public health diseases themselves which affect picking them like measles outbreak and other issues that will affect picking with the other 5. So how will this statement be?
Yes, the doctors and all see measles, certain extent, that chronic one can able for make dosing. And also even the ironical part of it, we very bad is like when some nurses and even go give them maclate there. So trust me, if you not give the maclate well, it will also affect the picking for make you even end up a disabled person. You understand? So if they go for go prevent something, and then you go get it, the two way they try for prevent, you go also for go get them back. You understand? Because you go choke that picking, you go get abscess or you go choke in vein and everything. It's what can find. You know that I can tell you say one of the 5 maculates already they give the poliomyelitis vaccine. Now one of the hardest one where you give you picking, they really know say you don't give you picking maculates because it's so heavy that if that nurse not professional for doa, it end up also for give that person that picking disability. You understand? So it means say they still get for need for train more nurses on how they really give them maculates and they. You understand? We don't see picking when they don't go try for give. Then at the end of the day, he gets some swelling. You understand? He swell to certain peak that the mama know before see how for rubber more make and care. Then he can't have it. Then he begin work upside down. So you go for go prevent something there. You go get another thing. So he also tell you that WHO still need for also for see how the one way they send out for them people very professional for them will be trained. You understand? And also how them go also able for talk to the parent. And when you don't give that picking that maculate, waiting that parents for left they do. So you know will get any implication. You understand? So all of those things, nothing. And you also look at the area of we get people that don't talk. Some man people that just don't see. May this maculate I know they take. I don't see away they go on they go take picking. That school say they can't get this maculate, they can't do all of those things. So it tells you that also that do we say as a country we get them vaccine, them tell where they come, are they authentic, are they real? You understand? Africa they always say we get contaminated until outdated or waiting. So it means you also get to see the thing the vaccine the way they can at this country, they for make sure say they really purify. And of course I know they doubt that, but it's also something we can also be an effect. When they talk about effect, anything we get a tendency of 1% safe can be an effect. Why this thing for happen, even though I don't do this, I don't do that. You understand? So now out of there we research working the do. No say it's official, but we as human who are victims say we can go out and they look. Even though sometimes we can do on we own, not to even the WHO can hire we or neither the Minister of Health and Sanitation can hire we on the thing, but we say can go and see waiting we say for go know exactly how this thing they go about. So he also look at forget the authenticity of the drug stem or the vaccine the way they can for you not get something where you can get the picking, you get another effect. So if not, you not get the virus, you not get the polio cell, but you get another sickness where you go get where you go affect them either in brain or you understand or you're affecting food or whatever thing and so. So it can also be the issues and this. So Naomi could say we really really think say we really want that strong collaboration, that strong partnership. That's how we all go sit down able for brainstorm together and get the way forward for make we not get any reoccurrence in Salone, because Salone are one of the most underdeveloped country. And for letting kind of thing they happen back is completely not impossible. You understand? For me, I know I say completely impossible. We will say the possibility is very, very slim for let go happen again, based on waiting on it happen. And we give kudos to the doctors and to everybody but let's see how we can still get a watertight something. Collaboration, partnership, and efforts together for let we all sit down and say, waiting we for do for make we not get this. So there lies everything now. Let you not just look with that kind way. And I can tell you, say, you ask so many polio persons and now you can tell you, say, they are not being involved, especially, let's say, if we now win at the heads themselves now, we're not much involved. What about the other one they really don't they? You understand? So these are the things, and we get this scenario where somebody can born a bikini, just where he don't be disabled, just go, he go keeper, he hide out. We don't get so many of them at the village. So you answer, we say that person we don't become deformed, you don't get anything for doing our society again. You understand? So now we could look at the area of you and a victim, you don't waiting and go able for do for we. Waiting them for do the sensitization to the parents there, to the guardians there. Some man can born, the pikin die. He died, he left the pikin. That guardian, what thing will they do for let we get them? So you find out say most disabled pikin be stable them. Especially polio there, whatever, even blind or whatsoever. Now recently we see some self they get birth certificates or waiting. So the moment you don't know, if I don't want to know again for even go to birth certificates or yourself now on kids. You understand? So all of those things, I think they really we really want for let we see how we're able to engage with the authorities, the relevant authorities we do on this specific areas for let we really see what we can able to do.
Okay, before we dey get this polio free, we don dey see side the campaign wey be dey go around na kick polio, where the health ministry dem be dey go around and talk to people in concerning this polio. And now the issue of low immunization, that's now one thing where most people go count constrain and self will continue for post threats for sake of this issue. So now that the country don't be polio free, whose message where you think say now the well body sector and other partners the way they partner with the health sector for the send out now?
The most message is more rigorous, like what they say, more rigorous sensitization for make we see how we will continue for kick this polio completely out. Yes, and like what you say, the kick polio campaign was there, and I think say for continue. You understand? We will still continue the kick polio campaign, because if we stop, it's obvious that we go forget something again, and we get bodies them. I think an institution they unable for member we did in New England we did with the Minister of the UNICEF. We did the work specifically on them kick polio and then vaccine there also and everything. You know, to be realistic, I know I really they think say some of we able for know waiting for do and how for engage them, but sometimes if you the people don't know waiting and they do, how we get for them for strength in that thing in the districts they all districts like where you go na Falaba now, you go na there Karine, you go na them Ponts, them Pujeun. You understand how they go engage them people and then kind in place and they say this campaign this will they do, now this thing will they do. So a lot of messages then they will for develop together. You understand? And those messages them, you know, they say who feels it knows it. For we get to slow down, they say nothing about us without us. You really want for work towards say kick polio, then come to the one where you really know say it, you know, all develop messages. So now not turn away for develop like posters, then flyers, you understand, get the messages on WhatsApp and all those things in the media, get more sensitization programs them, like engaging the radio, television, you understand, getting then community sensitization, go engage the chief them, waiting for do. So you need those things for let we enforce them. You understand? Let we engage the people and get those things then. We self they take those flyers, those posters and go paste and go give the people and say, this not the thing this way go waiting. And you know they just do messages. Messages they get for the uniform, messages they get for see how they depict waiting you they say. You understand? Then thing the way they say illustrations. They say the thing and then you put the illustrations. So these are some things that we need for the. We not see them posters and they much again. I don't know because we don't the ministry don't they think say for the past 4-5 years now we know they get her. It don't completely decline. when they go and pay space anything in the. But he really needed now. You understand? For me, can really put anything in it together and get some very good messages there now. We will all able for develop together and make sure see we able for send out to society.
Okay, you mentioned something like we say for make up them messages there, and we call some districts there, and some of them districts then they where you go now some of the chiefdom them you dey see nothing no dey no community health center and save the road self even bad. So some of them thing then they I wanna get for ensure say una incorporate her into una campaign messages them or una get for meet with the right people and bring forth some of them challenges and una think say people living at the provinces them they undergo we go make if issue thing and not be addressed quick we go see the rise of polio then go begin to record some of the cases them back.
Like I say, the Minister of Health and Sanitation gets a very big work now for make sure see we'll not get anything again. For we it could be a very big slap that like where you don't fetch all this while and then you can't see any kind of thing they can happen again. Now like you fruitless endeavor. And when they see one case we then see it will take another 5 years plus again for let them see yes we'll not see case they will agree against see polio free. So we'll not go one for really go back to that and at least all they get to forget to resources and another sign out for them way before develop the country. So it means say you get the one the committee like we then get not for break and for still get short committee and also forget some networks. You get some network because you get some parents, you get some people and they born and some outcasts and they not to hospital they born. We're happy that policy they really put policy and say everybody for born hospital because you born hospital you get tendency for let the doctor will tell you when or the nurse will tell you when how for can take your immaculate and everything. But how many people in the province? And then this city who does they mention they born na hospital. Most now also they born. You get them mommy they will experience and see we color deliver you and they deliver them. So it means you get forget that community engagement. For see you talk with the chief, you talk with them youth leaders, you talk with them mommy queen them and all of those people and bring them on board. So it's a very big fight all a very big collaboration all for bringing together and make sure see the moment you like that person born a house, they're able to forget the nearest like in that your village or that you waiting, but you're able to forget to it for let people that they go meet there and then please then they forget any vaccine. So it means you get every day you get for expand and I can say everybody knows say now the prevalence of giving birth don't increase. We look so many people and now they give birth and everything. So if you mean they bring their vaccine they also have how much, you mean you get for increase the number. And you get for get more people and for go now the more outcast areas and for see who side picking and day. You understand? Because some man not can plan for born, he just feel say no more. Why born? I for keep the picking, person not for even know say I don't born. So all those cases, how they uproot those cases they for reach 10 people in day for let you able forgive them. So no we get a reoccurrence. I can tell you see it's really a big fight. But if they renege, then we will get them. But if they open up and then bring other people like all of those things where they talk to, I'm sure we'll get better things will happen where we'll get any reoccurrence.
Okay, most people they see and say ending in polio virus na Africa na one of the greatest public health achievements that when you they think of the coronavirus with the Awe and Bog African countries them. Now we see two countries them where this virus still living at Pakistan and Afghanistan. So what do you think say then two countries then they not able to get right it?
Because you one clear thing is you don't give everybody the immaculate, you get tendency forget the thing. So say now war country there. Then country they don't come up a serious war we don't long term. So it's obvious that they're not going to forget everywhere. Also war they expect nurse for go give vaccine because they say get life inside the feed. You understand? So you get for look at that they see now one of the reasons there. Way certain are able for reach to everybody. But like and clear cuts, chill for see them simply because they get cases because they're not able for reach out to everybody. You understand? And when you reach out to everybody, you get if you not take them vaccine and it's obvious that you get that 60% say you end up for become a polio. You understand? So now I think say the WHO, I'm sure they everywhere in the world. It's a world organization. I'm sure they get their own strategies and get their own policies them way they don't put in place for make sure say they able for cover across the wall at the whole wall because they one side, me see it's not possible for lay up on other side. You understand? So I think this down in at WHO at all at large and then get them the thing they waiting for do. But I think see in sensitizing the society, basically when you not give you picking the vaccine, you get tendency for become a polio. You understand? And if when it become polio, it's obvious that it will become it not able to forget do everything well in society. And obviously you want you picking for you picking be like within the
Okay, with this polio freeway salon they part off, you think say continuous vaccination and now then for intensify am?
Of course, yes. The more the merrier right now. Like I say, the people are more now. Therefore, add more of the vaccine and now for get to people because I can tell you say the sensitization now on the high. You don't get the people now don't know say yes if this don't happen if this I not do this will happen to me. You understand? So the WHO, the Minister of Health and Sanitation, also for do more increments in giving out those vaccines to people, for get more involvement of society, for try for engage more people for the born house, either go born hospital. You understand? So now all of those things now for put together, and of course use the media continuously. Call some of the victims and let them continue for engage the people them way for prevent them so let them see realities of life. Let them see yes, will not just they talk. Waiting. These are victims the way because there's so happen and so they end up. You understand? So you asking question, I think say we need more effort, we need more money because this for getting vaccine in I can tell you say the money. But you get so many big organizations that really sponsor the Bill Gates, the Miranda, Bill Gates Human, understand the Rotary Club, So those are all institutions that are all at large where they put money into it. So it means the more if you do something, how you gonna do it for make sure see you don't do harm is for do something like you get an evaluation and monitoring and evaluation programs there at the end of the day. We don't do this. Can we do some monitoring and say yes? Everybody in this community of this able for them picking them with under 5 are able for get them vaccine. You understand? So you need more proper monitoring, more evaluations on how the process they go, how you will bring more people in. It's about commitment, commitment from the government side of it, commitment from the parent side of it, commitment from the community stakeholders. How everybody gonna say yes, we don't want to make this thing happen again, but we need to see how it's about information flowing, communication and information for the flow within those sectors. Then we see something positive will happen at the end of the day.
Okay, so what do you think say that some of the challenges them we dey in this polio eradication way they don't be problem for long time?
Finance was key in challenges because Saluna may get that capability for getting funds then so it was a real challenge for make them able to score this goal. And the commitment also from the government side of those predecessors and everything for make sure see everybody able to get time, not just limited thing. So it means you can forget commitment, just like waiting the president do and say I don't allocate so a percentage of budget to health sector. It tells you there is commitment in health issues. So tell me say the government not able to acquire the requisite number of vaccines that will for come for say for kick polio. You understand? So the commitment there was for me I would say there was not much commitment we made day from the government part because this is a government, not no NGO, no partner, no able for do that kind of work in the it will only complement, just like when you get free healthcare. Now you don't see WHO may they buy, UNICEF may they buy drugs, DFID they buy drugs. They all on cut down a bit because of funding. Because I don't know. So they expect now the government for take that responsibility. For say yes, we don't say free healthcare. So now we don't say for put more money on that. So DFID can done. You understand? We don't see anybody we know now within the running. Say DFID don't pipe down on the issues them how they do program in the country. So they tell you see governments need more work for do for let them able for do it in they do. And we also look at the parents side of it. How many parents may believe in and say, I no give the picking market to go get this. So if you not believe in that and then you do, then you obviously you see what thing happen. So another challenge was also how for perceive or for change the mindset of them parents, and they say, I need for take me picking for go for market. And that has increased. So I make we able for sit down, they say, for let you picking, I will say bonnie picking. In fact, if the mommy make negligence, the partner will make negligence. Or that host, if mama or papa or sister and lady, then they tell you, you don't care you picking for market. You don't take the number 5 market. How much market you don't take? You understand? So we don't see that awareness. So that was a challenge for change the perception, and that has happened in Salona. We don't see all of those things don't happen. So these are some of the key challenges then, and also how the society itself will be able to look at the issue. Say yes, we need for building people are so there now because of this thing happen. So taking down a filter down to everybody to the village side of it.
The program is still a listen to Now Young Challenge, where they can see live from the Society for Radio Democracy, 98.1 FM. You can also listen to on the internet on www.radiodemocracy.sl. You can also watch we live now Radio Democracy Facebook page. The program is still listen to Now Young Challenge.
Everybody wants.
You want know wetin dey happen na the disabled community na Salone?
Now for listen to our own challenge program, where Radio Democracy 98.1 FM, they bring to you every Thursday 4 to 5 p.m.
The program they bring to you issue we get for do with people where they live with disability, by way how in they look inside disabled law them, talk to policy maker them, plus other people, and we own challenge. They for all disabled na Salone.
The program they come to you every Thursday 4 to 5 p.m. and now Osiwa with Africell they support Radio Democracy for bring this program come to you.
We own challenge for all disabled people na Salone.
The program is still a listen to Our Own Challenge, where they can to you live from the Society for Radio Democracy 98.1 FM. I still get with me Santiki Kagbo, now the president for the Sierra Leone Union on Disability issue. Well, there for talk about the polio free, where Africa, WHO don't declare Africa from. Also, they say this not a good thing, we don't they happen. And safe within some of the thing them we government need for do for CC, then continue for make Salone no go record another polio case again. Well, as we not get better time again for wrap up the program with all of them thing there we don't happen concerning the fight against the polio. You talk about the vaccine, and the vaccine I want to way like you need money for make them go continue for the give picking them with the other 5 so that they not go for record any sick again. So going forward, within the association self go do in light of that one day for like say talk to people why important for they take the polio vaccine.
Yeah, like we know we need we go definitely no sit on the oasis thereby sometimes say if the mountain no go meet you, you go meet the mountain. So we will make sure say we engage the relevant authorities and the Minister of Health and Sanitation already we don't say so. That them we will make a letter for rights them and then we try for engage them for let see how we bridge those gaps we done the day and for let we all not sit down and just look say waiting will happen everything. So we go call we go make sure so we reach them. And also to some extent we as victim we can also do our own bits because the kind you get Ebola survivors. We say can we own bits. We get a union we then call it a union of polio persons. A whole union winner for victims that we don't survivors of polio victims. And then they under the union. So now for just work with them and also see how they will go for right projects, push to other donors, the other partners them for do more sensitization and go out in our society for tell them the realities of life, waiting them on the face. So that we tell person, waiting me don't face how me day. Trust me, no go want that person let you own time so. Because tell you go to be successful, I can tell you, I go in God in power for let we able for success some of all we will reach to this peak. Because technically you don't be polio, definitely you're not able for claim step. You know it is. So that's inside the way you go, even though you don't learn your book, you apply for job, they will tell you, see, you never claim this step, or not they give you the work. You understand? Then we'll tell you, see, we'll not get a special device for you for level the waiting, who place not accessible and waiting. So then will they cry you down. So it takes you for let you say, la avoid this. So we go engage the society more together with those unions and other organizations there for let we all work together as one and continue for push. So government continue for push, to donors and then support, and also make sure see whatever activity they do they involve. You understand? It's about inclusion and participation. So we'll make sure, say, by force, they involve us. Because we know we'll sit down. Because if anything wrong at the end of the day, now we then will say back, say, what are you doing? Like how you ask this question. So, and at least now I'm able to tell you something, say, we meet them, we will engage them, we will this, will then I get something, a pointer. But if I don't have a pointer, it's obvious that to some extent I don't know waiting for say. So we will do our own best to continue the engagement and meet the relevant authorities and also get other bodies that will bring on board for continue for work with, and also go at the outskirts of this country and continue for engage parents for let them do what's in the needful for save them, picking them.
Okay, well, plenty thank you, Gemini, the program.